So there really is a lot of information here, and most providers will ask the questions, where do I start? First of all, what we tell providers is, please, you've got to be realistic about this process. This change is going to cost you some money. Thankfully, we have the incentives in place right now that cost can be minimalized, because when we talk about, say, $44,000 in Medicare money, we are talking about per provider. So if you have a practice with 2 providers, it's not $44,000 for the practice. Indeed, that would come closer to $88,000 if you met meaningful use for both providers. So there you are. You have a considerable amount of money put in front of you to help with this change. But the one thing that you might not get a lot of help with is the cost of time. And that is just a fact. This change is also going to cost you some time. And sadly enough, this is not like Office Max where there's an easy button. There is not going to be one for this process. You are going to feel like you're jumping through hoops. And indeed, you will be jumping through some hoops. You certainly will be. So set your mind to that change. Set your mind to the realistic expectation that when you implement EHR into your clinic, it's not going to be hook up the computer, sign into the software, and bam, you're going. There's going to be a lot involved. Now, choosing a good software company is going to make that process easier. Making sure that you've purchased plenty of training and support will also make that process easier. But just please, first and foremost, be realistic. Second is what I just mentioned, finding the right software and the right vendor. Now, keep in mind that there are certification programs out there for software vendors, and they must meet this certification if you wish to comply with meaningful use. So the software that must be certified must say ARRA certified, and there are various bodies under ARRA that are certifying around the nation. So make sure that your software vendor is certified. Check it out. Also, find out who else uses the software. That's a really, really important question that sometimes we ask and sometimes we don't. But don't be afraid to find out. For instance, we are located, Randall Tech, Allscripts dealer here, we are located in Amarillo, Texas. And I can tell you in Amarillo, we have a few major big multi-specialty and family practice clinics who are using the software program. We also have Texas Tech, who is using the Allscripts product. You'll have several small practices sprinkled around the area that are using it. You also have Lubbock, whose health system Covenant is using Allscripts. You have just another hour or so down into Portales, New Mexico. You'll find a hospital association down there that's using the Allscripts product. I believe Baylor Medical Center actually just signed a big contract with Allscripts, and they will be implementing this spring. They're the big medical school in Dallas. Allscripts is all over the place. Statistically, 1 out of every 3 doctors in the United States uses an Allscripts product. So it's very widely known, very widely used. So just keep that in mind. Actually, I just read an article stating that Allscripts is going to be implementing in Australia as well. An Australian health network over there, hospital association, I believe, has purchased the Allscripts product for their country. So that is just an amazing thing to know, that you have a software vendor that is so highly respected and so busy growing. You would hate to get in touch with a little mom and pop vendor who wrote their own product, and they're probably not certified, and they're going to be out of business in 3 years, and you just don't know what the stability is going to be. So please take that very seriously and choose a vendor who can just very readily spout off what their product has done and where it's gone. But also you have to keep in mind, is the software going to accommodate your specialty? Because if you're family practice or internal medicine, you're going to be pretty easy to accommodate because most software programs are heavily geared toward those specialties. Now, some of the other specialties you may want to ask about. If you're a chiropractor, for instance, ask, is this software going to meet my needs? So make sure you ask those questions and that you are demonstrated by the vendor the software program in the mode of your practice specialty, because that is very important. And then also find out, is your vendor going to be easily accessible and are they experienced? You can certainly buy from a vendor who's not in your city, and people do that all of the time. But how easy are they going to be to get a hold of? Are they serving other clients who are also remote? And how do they do it? How will they handle it if your workstation goes down and they're 2 hours away or 5 hours away and they can't get to you? There are ways to do that. But just make sure that you know how accessible they're going to be, how well they answer their phone, and how experienced they are. Randall Tech, for instance, has been serving medical practices for almost 20 years. And I would say they probably have active 250 or so practices that they serve on a regular basis. And so find out what is their level of experience and their longevity in the industry, because that's very, very important. And third, you have to make your mind up with the first and second steps, and then you just have to do it. These changes are inevitable. They're going to happen whether you like it or not, and we just all have to love it because we have to get in there, get the stimulus money while we're able to, and go with that change. Ultimately, your practice is going to be more efficient. I can tell you that I was around back in the 80s, and a lot of changes happened to practices in the 80s, streamlining through the Medicare program and computerization and so forth. And I remember in 1990 when we were told that Medicare would no longer accept a handwritten insurance claim or a super bill taped to the top of an insurance claim. Now, yes, handwritten claims. I know you're probably thinking, what? Is she serious? And yes, I'm very serious. But when that happened, we had two choices. We could either type out our claims, or we could utilize a computerized system to print them out. It was considered heavily, and a lot of practices decided to type them, but more practices than not decided to go with the computerized programs. Now, this made doctors incredibly angry. There were no stimulus programs in place. Most of the employees at that time had not had computer training in high school, and it was not well known around the area to have a computer in your home. Hardly anyone had one of those. This was very, very early in the computerized world for all of us at-home users. So the practices had huge changes to conquer. The cost of implementing a new computer system back then for the practice I worked in was over $40,000, and that was in 1989, 1990-ish. So that was a lot of money now, much less back then. So we had a lot going on, big learning curves, and practices were in a little bit of a hurt for a short time. But you know what they found is that as they implemented, things were so much easier than using the old pegboard systems and ledger card systems that it became a very happy occasion. So many doctors still worked side by side with paper systems for years because they didn't trust the computer. But as those doctors began to retire and the younger doctors began to come in, we really started to see medical offices step up and really appreciate the computerized system. So you're going to be more efficient. It's the same way with paper charts. We're getting rid of the paper. We're not going to be chart hunting anymore. We're not going to be spending time filing things in charts or looking for missing pieces that aren't in the chart when they were supposed to be. Papers aren't going to get lost on the doctor's desk or at the nurse's station or buried under a pile of information at the front desk or anything. This is going to be so much easier. So that's part of the just do it. Just jump in there and realize that this is really going to be something that you're happy about in the long run. Now, selling a practice is also going to be virtually impossible if you're still on paper. So if you're thinking, I won't be in practice that many more years, I'm planning to retire, I'm going to sell my practice and go live on a beach somewhere, that's wonderful. Good for you. But if you're selling your practice probably to a new doctor who's coming in and maybe starting his first practice or her first practice, then a paper practice is going to be a hard sell. And if you do sell it, you will take considerably less money for it than you would if it were an already up and running EHR practice. So keep that in mind too. And then really one of the last things I want you to keep in mind is please don't get yourself caught up in trying to make new changes and adapt to new systems all at the same time. As we all know, we have ICD-10 coming in October of 2013. Whew, that's going to be a big change in itself. We're all gearing up for it. We suspect that we're going to lose some seasoned coders in the process because they've already been through so many changes over the last 25 years. You know, some of them are just going to say, I'm done, it's over, I'm not making any other changes, I'm retiring. And that's okay because we're going to have a whole new generation of coders coming in to take their place. And that's okay, but you don't want to be forcing your employees and yourself to be under the guidelines of trying to implement EHR and get used to that. At the same time, you're struggling with making sure you have the right diagnosis code sets on your claims and that your electronic systems are working appropriately with ICD-10 and all of those transmission concerns that may take place. You just don't want to have to battle that all at one time. So let's do the EHR now. Let's get the stimulus money for it. And then a year and a half from now, let's go ahead and gear up to implement ICD-10. So just keep those things in mind. First, second, and third, those are your starting points. Be realistic, get your head in the right place, do your homework, do your research, and then just do it.